You know, we've done so many stories over the last several months about the pandemic. Many of us are probably wondering, what does it actually feel like to be diagnosed with COVID-19? And one woman in the Cape Fear knows all too well, spending a month in the hospital.
At one time, she was so close to death, a priest was even called in to administer last rites. WWAY's Sydney Bushell has her story and her advice for the rest of us.
The chaplain had called my husband and asked to give me last rites. That's how close I was to not being here.
Linda Blanchett is thankful to be alive after a difficult battle with COVID-19. The Brunswick County resident has been undergoing cancer treatments for 3 years, and when she felt short of breath in June, she assumed it was because of stronger treatment, but came to find out she had contracted coronavirus. Admitted to Novant Health on June 11th, she spent 35 days in the hospital.
I was able to battle through with lots of prayers, great doctors and nurses over there, constant care, but what I remember is them constantly talking to me, addressing me by name, and I think that helped because I would want to respond even though I couldn't.
She avoided a ventilator but was put on a machine to help with her breathing.
The pressure from the air was unbelievable, but needed.
While Blanchett had a hard time, she says her husband Ray went through it right along with her, even though she couldn't speak most of the time.
But they would put the phone to my ear so I could hear him, or they would come in and whisper, "He called, he said to tell you he loved you."
But 35 days was a little too long for him to go without seeing his wife of 56 years.
I'm laying in the bed and I look over at the door opened. There stands my husband. He snuck in. He said, "I just had to see you. I just had to see you."
Now that she's home, they don't have to go without seeing one another, but there are lingering side effects. Blanchett still has shortness of breath, numbness and weakness in her hands, which doctors aren't sure are related to COVID, but say it's a possibility. And about 2.5 months after coming home, she started losing her hair.
My cancer treatment does not cause hair loss. And in researching, we found out there's something called medical shock hair loss. So if it happens to people, I want them to be aware. Don't be afraid of it. It's part of the process.
She urges everyone to take precautions.
You have to know that anybody can get this. Any age can get this, and the severity, you don't know what it's going to be.
Frustrated when she sees people without masks, she says it may be their right to not wear one, but it's her right to be upset.
If you think it's a struggle, try trying to breathe in the hospital with the face mask on, with forced air. It's just not worth it.
Most of all, she wishes everyone a happy and safe holiday season.
If we're all smart enough to do it right this year, next year we won't have to do it this way.
In Brunswick County, Sydney Bushell, WWAY News.
Blanchett also extends a special thank you to all the blood donors. She says she had 3 blood transfusions to help her body fight the virus. She encourages everyone to donate blood to help those battling COVID-19.